So according to you, why oral surgery?
Every branch of dentistry contributes to the patient's well-being, but this is something which directly relates to a life-saving opportunity in many ways.
Yes. What do you see happening a decade from now? You see implants being replaced, or you see implants continuing as the staple of dentistry?
So, implants have revived dentistry, but the implants are also now in an era of modification.
What are the checklist before you start the procedure?
The bone, which was the topmost priority prior, is now the second and the third, and the first is systemic history.
What is your take? If someone wants to take a plunge in implantology, what would be your advice, doctor?
There is no clear-cut demarcation in that, and maybe futuristically implantology might come up as an entire branch for MDS, but as on date, it is something which is open to everybody to learn.
Good morning, everyone. And today, for today's podcast, on behalf of Fine Feather Dental Academy, I welcome Dr. Utsav Bhatt, leading oral maxillofacial surgeon and implantologist from Ahmedabad. You're welcome, doctor.
Thank you, sir. Pleasure.
So let me introduce you to our speaker for the podcast, Dr. Utsav Bhatt. Dr. Utsav is an alumni of Government Dental College and Hospital, Ahmedabad. He is a gold medalist in the Faculty of Oral and Maxillofacial Surgery from Government Dental College, and he has also done his fellowship in the reputed AOCMF Institute located in Austria. Besides this, he was the oral surgeon to the Governor General of Gujarat, His Excellency, for more than 10 years. He has had an academic experience as a faculty in the Government Dental College and Hospital for more than 16 years, where he has traversed the entire spectrum of oral maxillofacial surgery, right from exodontia to trauma to reconstructive surgeries, plastic surgeries, and his specialty or preference is for the TMG surgeries and rehabilitative surgeries. So it's not limited to this. He is also a leading implantologist and has He is well versed in the entire spectrum of implants, right from the single endosseous implants to the corticobasal to the current tilted implants, and his forte is in pterygoid and zygomatic implants, where for atrophic jaws he gives immediate loading, complete full mouth rehabilitation. So doctor, what would you say about this? How this path you have traversed, right from the faculty member to this practitioner? You have traversed both the academic as well as the private practice. So what are your views about the two? Is there a difference?
First of all, at the onset, I would like to thank you for having me here. It's an immense pleasure to be here, sir. With all the due respect, anybody who is pursuing or who is trying to pursue MDS would value each and every branch, and all the branches have their fair shares of significance.
So according to you, why oral surgery? Why it fascinated you so much? What attracted you towards this branch? Can you be more specific?
Yes, so during internship, when you would see your seniors staying in the hospital 24/7, attending the emergencies, and just
The only branch which is resembling the
it
surgery
actually makes you feel like you are, I mean, every branch of dentistry contributes to the patient's well-being, but this is something which directly relates to a life-saving opportunity in many ways. So that's the reason why that is what appealed me the most, and I would rightly say that I cannot imagine a place better than Government Dental College, because it gave us exposure to almost every kind of patient whom you would read in your textbook, and you would have an opportunity to see or treat those patients. So thanks to that.
Yeah, so it's the only branch you can say in dentistry which makes you feel like real surgeons, right?
Yes.
And having emergencies and having all that
Yes.
which we normally associate the medical branch or the surgical
I
branch.
mean, during your residencies, if you finish your ward work at around 12:30, 1 at night, you would still have an opportunity to go to orthopedic wards or to the ER rooms, the emergency rooms. You can just spend the entire night there trying to learn how they attend the emergencies, seeing those trauma bays where the primary care is given. So the learning is endless with this particular branch of
Wonderful.
surgery.
So, doctor, you just now described why you were attracted to oral surgery and why you chose that as your post graduation faculty. But since you are also a general practitioner or private practitioner and very heavily into implants, I would just like your opinion on how do you think dentistry is going to evolve in the next decade or two?
So, so there is a significant shift in the way dental practice has been, sir. I remember during our undergraduate days, predominantly it was extraction. Of course, I'm not that old that there was no significance of the
You
restorative
make
and
me, you make me sound more older.
But yes, having heard from our senior faculties that early dentistry was extraction and then dentures. That's probably the two ends of the poles, that extraction and the dentures. That is it. Then came in the phase of wherein extractions were followed by bridges, wherein patients started seeking for a more convenient restorative options. Then a large duration wherein a lot of efforts have gone into preservation of the tooth, and endo branch has evolved like anything. But after that, I feel there was some brief duration of lull where, to be very honest, 12th pass students, they had kind of started withdrawing from their inclination towards dentistry because there was a feeling that dentistry is kind of saturated. And then came in the implants, which have revived the field of dentistry in a big time. And why I feel so is because now in an era where there is a lot of patient awareness, there is better affordability, and patients have started understanding that the teeth are associated with the quality of life, wherein the longevity is getting longer and longer with the medical science progressing. Having a long life without teeth is like a punishment.
Absolutely.
So
Absolutely.
quality of life is important along with the longevity, and then therein comes the role of teeth.
Implants.
And where if the patient has lost the natural set of teeth, implants are
The third set
extremely
of
important.
dentition.
Yes,
Yeah, the third set
yes.
of dentition provided by us. So, what do you see happening a decade from now? You see implants being replaced, or you see implants continuing as the staple of dentistry?
Implants have revived dentistry, but the implants are also now in an era of modification. What started with very passive threaded parallel implants to now very aggressive threaded bicortical anchorage implants. A lot of R&D going on in the design, the thread pattern of the implants, and along with that, a lot of prosthetic options. So I feel that the entire paradigm shift is now towards restoring the patients irrespective of the deficiency of their bone, as well as restoring them as fast as
So
possible.
they're pushing the boundaries more and
Boundaries,
more.
yes, yes, yes. Very rarely, except for when there are some absolute systemic contraindications, bone, which used to be the primary factor to say yes or no to the implant, now that is a second and third priority. It's the systemic factors. If the patient is systemically fit, then majority of the patients would be fitted for
So
implants
we
in
can
some or
provide
the
an option.
other way. Yes. And it's no longer the thread form implants, now the polished surface corticobasal implants, and now a step ahead wherein we've been into a practice of custom made patient specific implants. During the COVID eras, we encountered a lot of patients who required aggressive resection of the jaw, some patients requiring total maxillectomies, and young age groups. You can't expect those patients to be happy with dentures for another 50, 60 years.
Yes.
You need to offer them better
Options.
options. and therein came these patient-specific custom-made implants, and which have been serving very well.
So these custom-made implants are 3D printed?
Yes, these custom-made implants are 3D printed depending upon the type of the defect that is there in this patient, and hence it's different for every single patient.
Wonderful, wonderful. So how more and more customized we are getting into even a branch like implantology.
Yes,
It's
sir.
wonderful to
Yes, sir.
know this.
So that's the reason why we are able to cater almost every single patient who is seeking for something better than the traditional dentures.
And so, doctor, I would like to ask something very specific over here to you. Since you are such a prolific implantologist, you must be having systems in place. But one thing I would like a help from your end would be, what are the checklist before you start the procedure, or what are the patho tests that you get done from the patient before you take a call whether I want to go for implants or not?
Yes. So, sir, as we discussed in the previous topic, that because now there is a wide array of implants which are available to an implantologist to cater to different kind of requirements, the bone which was the topmost priority prior is now the second and the third, and the first is systemic history. And that's where your basics comes into the significance. We remember our third year BDS days where in surgery and medicine, history taking to date is very important, and I very strongly believe many of the potential complications can be simply be avoided or filtered day one when you take a detailed history of the patient. So systemic factors is of first and foremost importance. Second is clinical evaluation. There are so many things. Say for example, as simple as a prosthetic space. You see a missing tooth. You see the ridge also seems pretty good. Lower six missing. A bread and butter for somebody who wants to start an implant case. And something that one might miss in those cases is that how far the opposite arch tooth has supra-erupted. If that is something that is missed in the first go, yes, you would be able to put the implant at that point of time. But when you come for the prosthetic phase, you would realize, oh, there is an opposite tooth which requires a treatment. And then there comes a communication gap between you and the patient. So the best thing is to first do a thorough clinical evaluation. So it starts with a systemic history, intraoral evaluation of that side, of the opposite arch as well, and then eventually comes the phase of the CBCT assessment. Hence the bone now is of third position after the systemic and the clinical evaluation.
Wonderful. So this tells us how you have to have the entire picture in mind before you communicate or even suggest an implant. So once you do the clinical evaluation, you consider all these parameters, then you inquire about the systemic history, then you get specific examinations done for the bone, like the calcium level,
the calcium levels or the bone densities, the DEXAs and all those things, sir, are of significance, but more for the load bearing joints. For the jaw joints, I feel yes, density is of significance. D3, D4 levels are D3, D4 bone densities are of importance. However, there are ways to navigate through such situations wherein you can use a bicortical anchorage and still achieve reasonably good stability. But yes, if the patient has got good bone, but if the systemic history is such which prevents you put across,
the calcium metabolism is compromised, then
yes, parathyroid levels and all those things matter. Yes.
Wonderful, wonderful. So doctor, that brings me to the last question that I have. If you remember, during our times, root canal treatment was considered to be the purview of the postgraduate endodontist, right? And the BDS were not supposed to learn since it was a specialty branch. But implant is not under any specialty. Initially, it was thought that only surgeons can do. But what is your take? Should any BDS graduate go for it, or does he or she require any specific skills to do implantology? What is your take? If someone wants to take a plunge in implantology, what would be your advice, doctor?
Sir, we are living in an era of Google, which is an ocean of information, and now the patient awareness is gone to such an extent that patients come seeking, sir, आपके यहाँ पे do you have that screw option for replacing the teeth? Even the patients who are not from a very educated background, they would still know that there is some sort of a screw which can be used for treating or replacing the missing teeth. Now, imagine if, as a doctor, if one is not trained enough to at least answer those questions, then one is genuinely lagging behind. Because uh, there were times when, as you said, sir, implants were considered to be oral surgeon or periodontist or prosthodontist's subdivision only. But there is no clear cut demarcation in that, and maybe futuristically implantology might come up as an entire branch for MDS, but as on date it is something which is open to everybody to learn. And as you said, sir, that root canals were something that were done by only MDS endodontics, but now every practitioner has to incorporate that to have a sustained practice. I see maybe in next maybe few years time, for every clinician to have a good sustained practice should be able to do at least basics of implantology, and if not do, then at least be well versed or aware enough so that when the patient comes seeking for that treatment, they can at least primarily satisfy their queries. So it's time that anybody who is into practice or looking to start their practice takes a plunge into this vast endless ocean before they freeze into the old methods.
Yeah, so to be a contemporary dental practitioner, implants is
Are
the
a must.
one of the most important
Yes.
skills that you have to learn
Yes.
once you pass out. Wonderful.
Yes.
So that really makes me realize that how it has evolved. I have seen dentistry since last what 30 years now, 35 years, and as you said rightly, in our times when we were students, it was mostly about extraction and dentures and cleaning and filling, right? So now it has evolved to much more. And as one of my colleagues said yesterday, it's now become want based and not need based,
Yes,
right?
true,
So it's
sir.
no longer fueled by pain and problems and
Yes, sir.
fear, but it's replaced by getting new things, and new vistas have opened up in dentistry. Really good time to be in dentistry, I believe.
And it is something that is going to be the future of dentistry. So take a plunge into it, but make sure that you make yourself competent enough to be able to treat and satisfy your patients with utmost ethics and clarity in your mind, because this is something that is eventually going to be a part of the patient's body for a very very long time.
Yes.
So make sure that you train yourself at a correct place for a specific correct duration before you actually get a hold of it onto the patients.
Wonderful. It was nice talking to you, doctor. And with this, we conclude our today's podcast. On behalf of Fight for the Dental Academy, I am very happy to have this wonderful conversation talking about the implantology branch and talking about the newer developments. Hope it helps many of our viewers to grab this opportunity and become competent practitioners and including implants in their practice. Good night, doctor.
Thank you, sir.